My name is Dan Bicey. I'm a distinguished professor of psychiatry, medicine, and clinical and translational science at the University of Pittsburgh, where I also hold the UPMC Endowed Chair in Sleep Medicine. My research focuses broadly on sleep and circadian rhythm. Within that broad area, I've been particularly interested in how we measure sleep in humans. I'm interested in insomnia as a clinical problem, and I'm interested in behavioral interventions that we can use with people to improve their sleep. A sleep study takes an individual out of their environment, puts them in an artificial environment, instruments them with wires all over the place, and then we tell people to go to sleep, and we assume that that somehow represents that individual's typical sleep. Well, on the surface of it, that's not a very likely proposition. So what we needed were ways to measure sleep and assess sleep as people actually lived in their lives. We needed some kind of self-report assessments. My colleagues at the time, who were my mentors, again, Drs. Kupfer and Reynolds and Monk, had devised a series of questions to ask people about their sleep. And they had collected these questions, but what they didn't have is a way to kind of collect all that information into one place, put it together, and ideally come up with some single score that would characterize how good a person's sleep was, from poor to good. And that was the beginning of the Pittsburgh Sleep Quality Index. People started using it outside of our institution. It's been translated into 50-some different languages. We eventually copyrighted the Pittsburgh Sleep Quality Index in 2010. When the idea first came to us that this is something we should copyright, the process for doing that was actually pretty straightforward. They took care of a real problem for us because we knew that there was some commercial potential for it, but none of us in the academic sphere had any idea how to go about that. So the fact that all of those aspects are handled by the Innovation Institute really made it all possible and protected our intellectual property along the way. So it's been great. The people in the Innovation Institute are terrific. I've worked for the longest time with Carolyn Weber, who's kind of my partner in the PISCI. And Julie Starashuk as well. The whole institute has been really great and so supportive, and yeah, just very helpful at every step. My main advice to anyone who has a thought that maybe this is worth licensing, getting copyrighted or patented, my main advice is don't be shy. Give it a try. And we have such an incredible resource here at the University of Pittsburgh with the OIE. There are people there to help you, and that's kind of their function. They need you to bring your innovations to them, and you need them to show you how to shepherd it through. So it's a great partnership. Simple things can be very useful. I didn't design a new hip joint or a new heart valve, but I did work on something that turned to be a very practical use to patients and researchers across the world. So I'm proud of that.